This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the AUA podcast. I'm Dr. Judson Brandeis, and I'm so glad you're here. Today we're discussing benign prostatic hyperplasia, or BPH, a condition that's not just common, but nearly universal among aging men. BPH is the non-cancerous enlargement of the prostate, and while it's not life-threatening, it can seriously impact a man's quality of life, physically, emotionally, and even sexually. What is BPH? Think of the prostate like a donut around a straw. As the donut gets larger, it squeezes the straw. In men, that straw is the urethra. As BPH develops, it narrows the passageway for urine to leave the bladder. This leads to symptoms like frequent urination, especially at night, weak flow, difficulty starting, and the nagging sense that you didn't completely empty your bladder. BPH isn't prostate cancer. It's a histological condition involving the growth of smooth muscle and glandular tissue in the prostate's transition zone. Its exact cause isn't fully understood, but we do know that it requires functional testicles and is largely mediated by the hormone dihydrotestosterone, DHT, a derivative of testosterone. How does it work? As men age, their hormonal balance shifts. Testosterone levels decline, but DHT may remain high, fueling prostate growth. This is a slow, insidious process, often beginning around age 40 and progressing silently. Some men will have minimal symptoms. Others experience significant urinary disruption that affects sleep, work, and intimacy. The dynamic component involves muscle tone, adding to obstruction, and the static component is the actual enlargement. Is it new? Is it proven? BPH has been studied for decades. Treatments have evolved from invasive surgeries to modern tailored options. Medications like alpha blockers, e.g. tamsulosin, relax prostate muscles. 5-alpha reductase inhibitors shrink the gland over time by reducing DHT. There are also FDA-approved minimally invasive procedures like water vapor thermal therapy, RESUM, prostatic urethral lift, UroLift, and holmium laser enucleation of the prostate, HOLEP, all with robust data supporting safety and effectiveness. Why don't more people know about this? Despite the science, BPH remains under-discussed. Many men suffer in silence, chalking symptoms up to aging. There's stigma around urinary health and sexual side effects. Some are hesitant to start medications, others assume surgery is the only option. Add to that slow clinical adoption of newer therapies, insurance hurdles, and a lack of mainstream media attention, and it's no wonder awareness lags. What do patients experience? Treatment starts with an evaluation, symptom scoring, prostate imaging, and urine tests. For those on medication, results can take weeks or months. Side effects might include dizziness or sexual dysfunction. Procedures vary in recovery. Water vapor therapy is office-based with mild discomfort and a few days of downtime. HOLEP, while more invasive, is excellent for large prostates with immediate results. Patients often say they didn't realize how much they were compensating until they no longer had to. Personalized urologic care. No two prostates or patients are alike. At our practice, we use precision diagnostics to tailor treatment. Prostate size, symptom severity, comorbidities, and personal goals all matter. Some men prioritize preserving sexual function. Others want the most durable outcome. That's why shared decision-making is key. How effective is it? BPH therapies can reduce symptoms by 50–70%. TURP, once the gold standard, is effective but has a longer recovery and higher risk of complications. Newer therapies offer faster return to normalcy and fewer side effects. Combination medications, like alpha blockers plus 5 ARIs, are often more effective than either alone. And in men with erectile dysfunction, tadalafil may help with both issues. The future of urology. Urology is undergoing a transformation. Regenerative therapies are on the horizon. AI is improving diagnostics. Telemedicine is making care more accessible. And precision medicine is helping us predict who will benefit from which treatment, with fewer side effects. We're no longer practicing one-size-fits-all medicine. We're using biology, data, and empathy to offer targeted, effective care. Why I do this work? I've seen what happens when men regain control of their bodies and their lives. They sleep better, focus more, and feel more confident in relationships. They become better partners, fathers, and leaders. I do this work because men's health is often neglected until it reaches a crisis point. But it doesn't have to be that way. Preventive care, early intervention, and compassionate education can change the trajectory of aging. There's a better way to treat BPH. It starts with understanding, continues with evidence, and ends with empowerment. Thank you for joining me today on the AUA podcast. I'm Dr. Judson Brandeis. Until next time, take care of your health. You only get one body. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.